Welcome back to Nursing Education. Good health, good life. Today's topic will be pain, specifically non-pharmacologic interventions. So I'm going to read from the text a little bit here. So although pain medication is a powerful pain relief tool available to nurses, it is not the only tool. So there are various non-pharmacologic activities and treatments that can be used to relieve pain. And personally, I believe medication should be a last resort, not the first resort. Identify the cause of the pain and see if you can remedy that without using pharmaceuticals. But if you can't treat it any other way, then yeah, you would have to use a pharmaceutical. So the first method that is non-pharmacologic, the first intervention is cutaneous stimulation and massage. So included in this category are obviously massage therapy, as well as cold and heat therapies. So yeah, that is a very effective treatment. It can be effective for many people. So in regards to ice and heat therapy, which is the next category, we see that ice, or I should say cold specifically, is very helpful for decreasing inflammation. So that is a good natural anti-inflammatory. We know that application of cold promotes vasoconstriction, which seems to shunt blood flow somewhat, not completely blocking it, but slowing down the blood flow. In terms of heat application, heat promotes vasodilation, which increases blood flow and can contribute to pain reduction by speeding up the healing. So it's actually not exacerbating it, but expediting the healing process. So it's of note, it says here that their mechanisms of action are not well understood, so they don't fully understand how and why it works, but there are a lot of theories behind it. But it's probably one of the most ancient remedies is heat and cold therapy and application to treat pain. Next is TENS, or transcutaneous electrical nerve stimulation. So this produces an electrical tingling, vibrating, burning sensation in the area of the pain. It has been used in both acute and chronic pain relief. It stimulates the non-pain receptors. That's what it's believed to do. The mechanism is consistent with the gate control theory of pain. So that is a theory as well of gate control. Another explanation of the effectiveness is the placebo effect. So that's all I'll say about that. Basically, if you know about Dr. Ho and the little applicators that you put on your skin, and then it feels like an electric shock, or a little sensation. It can even cause muscle contraction. That's what TENS is. Distraction helps to relieve both types of pain, acute and chronic. And what this does is you're taking away the patient's or client's attention from the pain, and there are many different ways to do this. And one that they mention in this, I stopped the recording. One method that is mentioned here is described is a movie. So you can play a movie, especially with surround sound, and that can be one way to distract. Can be, besides a TV or movie, it can be music, which is another therapy. It just really contributes to calming people down. And we can see the opposite being used. When it comes to situations such as a hostage situation, they would use music, but not calming music, but very intense music, something that would kind of torture someone, get them to submit. But in this case, with pain relief, you want to use very soothing, um, calming music. You also have the stimulation of sight, sound, and touch, which I'm not sure how that works with a movie, but I think that's more related to massage. The next paragraph talks about family and friends visiting, so yeah, that would seem to imply touch being used. So that's all for distraction. Relaxation techniques. We have skeletal muscle relaxation. So this is more of a rhythmic breathing, slow breathing, uh, guided relaxation where someone is narrating to you, telling you to breathe in slowly, count 1, 2, 3, hold in the breath for a little bit, maybe 2 seconds, and then you breathe out slowly, 1, 2, 3 through the mouth. So you breathe in through the nose, because it doesn't mention here in the textbook, but when you breathe in through your nostrils, the nose hairs and the oxygen, they react to produce nitrogen. It's actually built into our nose hairs, into our nasal structure, to produce nitrogen. When you breathe through the nasal canal, when you exhale through the mouth, that's just the most efficient way to breathe, and that could help to possibly alleviate pain as well. Guided imagery is more of a very psychological way of dealing with pain. So you're getting the patient to imagine their pain in their body, so they're visualizing it and representing it in some way, and then you tell them to deal with it. Either they're breathing out the pain, or they're destroying the pain. They're dealing with the pain and using their imagination, basically, to sum it up. Hypnosis, that seems to be going into kind of left field, but I'm thinking this is not a hypnotist where they tell you you're a chicken. I think this is more of a hypnosis where you induce sleeping and relaxation, not fooling them to believe in something that isn't true. Although you could say perhaps that they don't have pain, which is not true. You can convince them that they don't actually have pain, and maybe a lot of it is psychosomatic. Neurosurgical methods, they talk about neurolytic procedures such as destructive nerve blocks. So they're saying this has limited effectivity. Untested, unproven therapies. So it says here people will become desperate at times. They will try anything, even things that perhaps they would not normally try. And many therapies can be found via the internet and libraries. It's not limited to, but they include chelation, which I have to look up, therapeutic touch, music therapy, herbal therapy. Think of aromatherapy as well. Reflexology, magnetic therapy, electrotherapy, polarity therapy, acupressure. We're going to insert there acupuncture, which I believe has been proven to work. It's been around thousands of years to traditional Chinese medicine. Emu oil, pectin therapy, aromatherapy, homeopathy. I'm going to stress homeopathy is probably very much underrepresented and should be explored more when we look at the homeopathic, naturopathic type of treatments and that field of knowledge and practice. Macrobiotic dieting. So many of these therapies are probably not harmful. I would venture to guess they aren't. Matter of fact, there's more harm in the pharmaceutical industry. There's a lot more unintended side effects that cause and lead to secondary diagnoses that, to be frank, a lot of patients just don't want. So that's why I do say it is a last resort to pharmaceuticals rather than these natural remedies. There is a place for pharmaceuticals, just not the first choice. In cases of severe pain, I would probably go to a narcotic such as cannabis, something with no THC, or perhaps you might need the THC if the situation needs it. So, despite this, a patient may find one of these therapies helpful via the placebo, or they're just helpful, period. So, they're saying the nurse's responsibility is to protect the patient from costly and potentially dangerous therapies, and and we need to evaluate these scientifically, which means you look at the data, which means you weigh the pros and cons, which means you critically think. You don't just believe something is harmful or something is helpful. You really have to prove it, and sometimes you do have to just try it in order to prove it. Not saying we're all guinea pigs, but you need to use your wisdom. You need to use your nursing judgment to determine, is this safe? Will this work? Has it worked? And whether it does work or not, why is this not being used more often than not? Problems arise when patients do not find relief or they're deprived of conventional therapy because the alternative therapy should be helping. So there's a belief that, this should work, and you just keep repeating something that is not effective, and you just stick to your guns despite the poor results. So that's a situation where you have to make a decision. Prioritize the patient's well-being over your stubbornness. It's important to consider cost as well. Is this within their affordability? And the nurse's role is to help the patient and the family understand scientific research and how that differs from anecdotal evidence. Yeah, we should not diminish anecdotal evidence, but we have to see what works, because everyone's different, and what may work for someone may not work for someone else. So we really have to listen to the patient and listen to what they're saying and what their body is telling them, and whether they are responding positively to this pain remedy. In addition, the nurse encourages the patient using alternative therapies to combine them with conventional therapies, the typical, usual, relied upon medical therapies, and to discuss this use with a physician. Okay, so that's not the end of the video. I'm just going to look up a term here. I did not understand what it meant, but it is starts with a C, chelation, okay, or chelation. So let's look that up and see what that is. And I'm going to just insert here. Okay, that there are other methods that were not mentioned in the book. Spiritual therapy. Spiritual therapy would involve prayer, various rituals depending on the religion, and those can be very helpful as well. Okay, so what is chelation therapy? For heart disease, okay, it involves IV treatments of vitamin C. Okay, so it doesn't exactly say what it is, but gave an example of what it could entail. So if we look this up, it's a type of bonding of ions of molecules to metal ions. Is the formation of multiple coordination bonds between organic molecules. So it doesn't seem to give us a straight answer. Chelating drug. Okay, so chelation is heavy metal poisoning removal, but one of the examples they gave does not really make sense to me. So, having said all that, that's all for this video. Thank you very much for your time and attention. Please like and subscribe this video and to this channel if you want more videos like this. I'm only covering topics that I feel are very relevant. If you have a suggestion, please comment in the comment box below, and perhaps I will cover that topic. So, thank you again. This is Nursing Education. Till next time, good health, good life.